Hey guys, it's Dr. Jacob, Fortitude and Freedom. Today I'm going to show you an ankle joint mobilization for the subtalar joint. So the subtalar joint is the joint that sits, that is between the heel bone and then the first bone in the foot. So the first bone in the foot is right below these two big ankle bones on the inside and outside. So that's actually, your two shin bones there. So below those is the first bone in the foot, and then there's a joint underneath there that connects the heel bone and that first bone in the foot. And so this joint gives us some side-to-side motion like that. And if it's stiff, it'll put a lot of extra stress on the soft tissues on the inside and outside of the ankle. So the muscles of the lower leg that come around and support the inside of the arch, or the muscles on the outer leg that go down the outside of the foot. The Achilles tendon can sometimes get aggravated as well. So what I like to do is use a ball, like a tennis ball or a lacrosse ball, and you can either put it in front of or behind that ankle bone, just below it, and that will stabilize the first bone in the foot. Then what you're going to do is you're going to use your hand and you're going to push the heel bone towards the floor, and like you're trying to bend it over that lacrosse ball. And that is going to mobilize that ankle joint and create some side-to-side mobility that we need. So that'll create ankle eversion or a little bit of pronation. And you can mobilize this for about 2 minutes for any good joint mobilization. I like 2 minutes as a common dose. And the ball stabilizes the first bone in the foot while the heel bone can move. Another option is using a double lacrosse ball. I just tape 2 lacrosse balls together here. You can do the same thing with tennis balls. There are some different types of peanuts you can buy, but I found that this size of the ball fits really nicely on the side of the ankle. So now you got support both in the front and behind that outside ankle bone. And then it's a lot more stable as you try and press the heel bone over top or past those 2 lacrosse balls. And you'll get just a much better mobilization that way. So if you're a runner or any type of endurance athlete, and especially runners, but you're having pain on the inside of the lower leg, outside of the lower leg, or the Achilles, check mobility of this motion of this ankle joint and see if you can improve that side-to-side motion using the subtalar joint mobilization.